In this video, I'm going to show you how to fix SI joint popping and cracking sounds. Stay tuned. Hey everyone, Dr. Rowe from SpineCare in St. Joseph, Michigan. So in this video, we're going to tackle clicking, popping, cracking, sacroiliac or SI joint sounds. This video is going to be broken up into a very easy step-by-step guide. So make sure to go through all the parts, all the exercises, and go with what is most effective for your condition. First, we're going to focus on just releasing all of the soft tissue around the SI joint. Next, we're going to put a lot of mobility into the sacroiliac joint with very good stretching exercises. Then we're going to do some self-mobilization that might actually end in a pop or crack into the SI joint. And last, we're going to focus on strengthening everything to help build stability around that SI joint, which may lead to less issues of those sounds in the future. So let's get started. In the first part, we're going to focus on getting rid of SI joint popping and cracking sounds with a nice soft tissue release into the area. I'm going to be using a tennis ball for this. If you do not have a tennis ball, take a sock, roll it up, throw some tape around it, that works too. Let's start off on the floor and our feet against a wall or a door. I like to use shoes with this because you have a little bit more grip. My knees are going to be bent at 90 degrees. What I'm going to do is feel on the bottom of my pelvis right here, and you're going to notice that there's two large bumps. If you trace that over just a little bit and kind of swing your hips like this, you're going to feel some motion into the SI joints. That's where we want to target, but we don't want to go directly over the SI joints. Instead, we're going to take the ball and go off to the sides, over the glutes, the buttocks, that soft, meaty portion. I'm going to place the tennis ball right over that spot that I'm feeling a lot, maybe some achy pain, and then just allow my weight from my legs to drive downwards into the ball. From there, I'm just going to rock slowly from side to side. Shake your hips more or less and just go from side to do a nice self-massage. If you feel like this is too much pressure, you can lift your butt up at the heels. If you feel like it's not enough pressure, you can drive downwards to intensify it to your comfort level only. But you want to try to do this one for a couple minutes. You can switch to different spots as needed. Go over anything that feels achy and really target at it. You can also go at different angles, maybe at 45-degree angles, circular motions, up and down, whatever works best for you. You can switch to the other side. Just go over the whole area. Try to concentrate on one particular spot for about 2 minutes. If you feel like you still need a little bit more pressure into that spot, drive down as much as you can and lift one leg off. So the tennis ball is off to my right, I'm lifting the opposite side's leg off, that left leg. And this will really put some good pressure in there. But you can just focus again on spots that need it a little bit more, and hopefully that will get that soft tissue to release and lead to less SI joint popping sounds in the future. In this part, we're going to focus on a big cause of SI joint sounds, which is tight, soft tissue. That tissue tends to snap with movement. This first one is a two-part process, and it's easily done in bed. So let's lay flat on our back, just like this, and bring one knee up towards our chest. What I'm going to do is keep bringing that knee up as far as I'm able to go. You'll start to feel it stretch into the back of the legs, glute buttocks, pelvic region, lower back. Really focus on trying to do as much as you can with bringing this knee up comfortably. Once you get to that point, what I'm going to do from there is take the knee and I'm going to press into my hands to form an isometric exercise. When you do this, you're really going to feel some pressure being built up around the SI joint. Really focus on that as much as you can. Press into the knee, hold this, challenge yourself for 10 seconds. From there, relax, try to bring the knee just a little bit further towards you, and then repeat. Do this 3 to 5 times. For the second part, we're going to incorporate a little bit more rotation into this stretch that might actually get this SI joint to pop. It's known as a corkscrew. I'm going to go to the edge of a bed. What I'm going to do from here is bring my leg up like this. Knee is going to be bent at 90 degrees. So this is my left knee. I'm going to take my right hand, place it on the outside of that left knee. My arm on the other side, so my left arm is going to go straight. It's going to go down like this. My head is going to follow my arm, and then I'm going to just simply take this knee and rotate it off the side of the bed. You're going to feel a great stretch into the lower back, pelvic region, into that SI joint. Try to bring that knee down as far as you're able to comfortably. Hold this for 15 to 20 seconds. You're just going to relax, and then you're going to repeat this 3 to 5 times. And remember, whatever you do on one side, always switch to the other side to keep them both in balance. This next sacroiliac stretching exercise is great because you can pretty much do it anywhere, at work or at home. I'm going to be using my beat up broomstick for this, but you don't need one. Just use a wall or a door frame instead. Let's start off with very good upright posture, no pelvic tilt either. What I'm going to do from there is take one leg up like this, put the heel at the inside of the other leg's knee. Let's try to take this knee outward as much as we can. What this is going to do is open up the pelvis, that SI joint. It's going into external rotation into the hips also. So we're going to hold this position for about 5 seconds. From there, what I'm going to do is I'm going to take the leg inward. So let's take that knee in and rotate the leg into internal rotation. You're going to feel the muscles across the pelvis get activated just a little bit differently. Challenge yourself to drive this in as much as you can. Hold this comfortably for 5 seconds, and then you're just going to simply repeat. Each repetition, try to drive the leg out further and also try to drive it more inwards. But 5-second holds, you want to do this for 5 complete repetitions. And then from there, switch to the other side to keep both in balance. So another big cause of SI joint sounds is because the joint itself is just locked up and needs to be released. Here are some great self-mobilization exercises for the sacroiliac joint. The first one we're going to do laying in bed. I'm just going to drape one leg off the edge of the bed. Knee is going to be at 90 degrees. The side that we're focusing on to get to release, what I'm going to do is bring that leg up. Knee is going to go straight towards the ceiling, and it's going to be bent at 90 degrees. The movement is very easy. I'm going to take the toes on this leg right here and internally rotate them. So I'm taking the toes inward. The next movement, what I'm going to do is take this knee towards my opposite shoulder. So since this is my left knee, I'm going to take it 45 degrees towards my right shoulder. But I'm going to take my hands, place them on the inside of the knee, and resist that movement. This is going to cause an isometric exercise that's really going to open up the pelvis, the SI joint. You might find that this just gives you that satisfying pop, crack, or self-release that you're looking for. Hold this comfortably for 5 seconds. Really challenge yourself to drive those toes inwards, this knee towards the opposite shoulder as much as you can. Take a breather and then just simply repeat. On the next repetition, go a little bit further with it. Again, challenge yourself because that's going to help open the SI joint up more and self-mobilize it. Do 5 complete repetitions and then just simply switch to the other side to keep them both in balance. This SI joint self-mobilization technique is one of my personal favorites because you can pretty much do it anywhere. At home, at work, you just need a sturdy chair. Let's sit with very good upright posture. What I'm going to do is have my legs about hip width apart. From there, I'm going to take my hands, place them on the outside of the knees. We're going to do an isometric exercise, so I'm going to drive my knees outwards into my hand and resist against it so it doesn't feel like my legs are moving at all, but it's really starting to activate muscles across the lower back, hips, pelvis. Do this as much as you can. Really drive those knees out into the hands and resist against it for 5 seconds. You're just going to relax, and then you're going to repeat this 5 times. Each repetition, challenge yourself more. And here's the great part. Let's take our hands right here, make a fist, put them inwards, and I don't know if you heard it on the microphone, but I got a very good self-pop into the SI joint. Drive them inwards. So I'm just going to do the same thing, but going inwards, resisting, and doing this for 5-second holds for 5 repetitions. If this does bother your hands, you can substitute a large towel or pillow instead. So if we're looking to get rid of SI joint popping and cracking sounds for good, we have to strengthen everything and build stability into the sacroiliac joint itself. This first strengthening exercise is great. You can do it in bed. You just lie flat on your stomach. What I'm going to do is I'm going to space my legs about shoulder width apart to start off with. Let's keep the knees straight as possible and then lift the legs up off the bed. You're going to notice that this just activates a lot into the lower back, across the pelvis, into the SI joint, the legs. Go up as far as you feel comfortable. Hold this position for 5 to 10 seconds. You're just going to relax, And then on the next repetition, try to drive the legs out just a little bit further and then repeat. The further that your legs go out, the more challenging this is going to get. So on each repetition, try to go out just a little bit further. But you want to do this for about 5 complete repetitions. To take this to the next level while you do this, let's take our toes and go inwards with it, and then we can go outwards. Experiment with this and notice that if there is a little bit of weakness while you do this, because it's going to challenge those muscles and everything around the SI joint and hopefully strengthen it. But give that a try, go with anything that feels weak, challenge yourself to make them stronger. This next exercise is great because it works so much in such little time. We're going to take 2 popular exercises and put them together. The first one being the fire hydrant. Let's find a sturdy chair, one without wheels, and start off on the knees like this. Put a pillow or towel underneath for extra comfort. Our legs should be straight from the hip down to the knees bent at 90 degrees. And I'm going to support my upper body weight on my elbows and arms on the chair just like this. Let's also make sure that we have very good posture, straight back. And the movement for the first part with the fire hydrant is very easy. I'm going to rotate my upper body along with my leg upwards like this towards the ceiling. When you do this, you're going to feel a lot of muscles start to fire. Low back, glutes, buttock, pelvis, into the hip, into the legs. Drive that knee up as much as you can. Hold this for 5 to 10 seconds. Slowly come back down and then go into the second part of this, which is taking it into a bird dog. I'm just going to bring the leg up straight at the knee, point my toes outwards, again for a 5 to 10 second hold. From there, let's go back to the starting position and then just repeat on the other side. And then you're just going to go into the bird dog just like this. But you want to do this nice, slow, and controlled. Really challenge yourself on the repetitions to drive the leg upward as much as you can, and then trying to bring the leg back and straighten it as much as you can. You want to do this for 5 complete repetitions on both sides to keep them in balance. If you liked the video and got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thank you for watching.